Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 941st episode. Let's have the headlines of the day. Sharp rise in teenage girls with eating disorders during COVID found a study. According to clinical survey, anemia prevalence among Indian adolescent females rose from 54% to 59% from 2015-16 to 2019-21. Adolescent marriages and motherhood, along with poor nutritional status and other socioeconomic variables such as wealth and education, were crucial risk determinants for anemia in Indian females aged 15 to 19 years. Iron deficiency often missed in young women, girls, research finds. Study suggests need for iron tests in teenage girls and young women. So let's go to the topic of the day. So today we are talking about anemia in teenagers, and the person who will be speaking to us today is Dr. Neeru Kiran Banerjee. Dr. Neeru Kiran Banerjee is a distinguished consultant gynecologist with a career spanning over 3 decades. She holds an MBBS and MD in obstetrics and gynecology from MGIMS Sevagram, Varda, Maharashtra. Apart from serving as an ex-lecturer and director at MGIMS Sevagram and later as direct as director in Obs Gynae at Artemis Hospital. Dr. Banerjee's commitment extends to various committees and subcommittees, reflecting her expertise and dedication. Recognized for her outstanding achievements, she has received many prestigious awards, including the V. Sabnis Silver Medal and the Swasthya Ratna Award. Beyond her clinical work, she actively engages in social initiatives, conducting cervical cancer screening camps, organizing continuous medical education sessions, and contributing to adolescent health education in schools. So आज हमसे ये बात करेंगी एनीमिया इन adolescents के बारे में. तो ये भी बहुत एक बर्निंग टॉपिक है और ये भी एक बहुत बड़ी सोशल सर्विस है जो आज आप करने जा रही हैं. तो shall we start?
Yes, ma'am.
ओके. सो सबसे पहले मैं ये जानना चाहूंगी व्हाट इज एनीमिया.
Thank you very much, Dr. Anita, ma'am. It's my pleasure that I'm here sharing the screen with you. Thank you so much. So you asked me what is anemia. As you already said, that anemia is a major challenge in front of us when we talk of teenagers. So let's understand what is anemia. Anemia is the deficiency of iron. And what is this iron? Iron is an essential nutrient which our body needs for day-to-day workup, and this iron cannot be made in the body. So it is essential that we take it through our diet or through supplements. And it is so much so important that it is called the body's gold. So iron is very very important for body's function, and it is a protein which is carried in the form of hemoglobin through RBCs, and our RBCs carry oxygen to different parts of the tissue for their work. So iron deficiency is anemia, and by WHO definition, if we test the blood test in teenagers, if hemoglobin turns out to be less than 12, we say that she is anemic.
सो ऐसा क्यों होता है कि टीनेजर्स आर मोर प्रोन टू एनीमिया.
Right. That's a very good question. Though children can be anemic, a reproductive age group female can be anemic, pregnant lady can be anemic, even postmenopausal lady can be anemic. But when we talk of adolescents, adolescents are the future generation. They are going to build a nation, not only family, a nation. A nation's prosperity, mental and physical health depends on adolescents. And who are these adolescents? They are the individuals who are in the age group of 10 to 19, according to WHO. 10 to 14 is early adolescent and 15 to 19 is the late adolescent, and youth population is 10 to 24. So they provide us a window of opportunity for interventions whenever there is any action is required to treat anemia. And why we are discussing anemia in adolescents? Because I said a window of opportunity to interact with them and to intervene, and they are more prone for anemia. Why so? Because it's the period of growth spurt. They start growing. It's a period of transition from childhood to adult. So, children are becoming adults, and the growth spurts causes increase in blood volume. So that needs more iron, and they fall into that group of anemia. And another thing is girls, they start menstruating, so they start losing blood, all the more prone for anemia. And then eating habits, naturally, all the school going and the college going children, they are with their friends and they start eating outside, processing junk food, that also could be the cause. And when we talk of rural population, early marriage, teenage pregnancy, repeated pregnancies, they also lead to double burden on these kids, and they fall into the group of anemia.
बिल्कुल सही बताया आपने। तो ये उनकी लाइफ को, उनकी पढ़ाई को, उनकी डे टू डे लाइफ को कैसे अफ़ेक्ट करता है?
Right, a girl when she is growing up and she starts menstruating, she doesn't know that she has iron deficiency. How do we know, or how do her parents know that she is anemic? It's the lethargy or the fatigue, early fatigue. She'll say, "I get tired very fast. I get breathless when I start running or start working or something." So when she complains of breathlessness, she gets tired, she has palpitation कि मेरी हार्ट बीट बहुत ज़्यादा हो जाती है, मेरे से काम नहीं हो रहा, या हेयर फॉल बहुत ज़्यादा हो रहा है, या पेल लुक है, और इफ शी इज इरिटेबल and if she is not able to sleep properly at night because of pain in the legs. So restless leg syndrome if these girls have, and maybe they are little irritable and they feel they are not able to concentrate on their studies. Forget studies, they are not able to concentrate on other works as well. So their study also is affected, their physical capacity to work is affected, and they have poor memory retention. They are more prone for infection because of lower immunity. So these could be the symptoms. And
अ,
sometimes they have soreness of mouth, they have crack at the edge of their lips. So these could be the symptoms. When you think, or if they start bleeding heavily during menses, I think the parents should consult their doctor.
yes, you very rightly said so. As most teenagers start menstruating, and that is the time they develop anemia. So, any guidance for these girls, like when they start menstruating, how should they go about it?
Yeah, when girls start menstruating, first thing is they should be very vigilant if the menstrual blood loss is more, number one. Number two, if they feel that they are feeling lethargic, they don't want to interact with their friends, they don't want to go out, maybe partying or something, they feel lack of energy, and they don't want to work, they are not able to concentrate, they should be alert. Number two, they should be taught about the importance of balanced diet or nutritious diet. So, menstrual laws, balanced diet, and good hand hygiene, like wash hands every time. Like in COVID, we all learned. So, these girls should know that they should wash their hands before eating. So, that also is important for them.
You had mentioned that they, start eating out. So, are wrong dietary habits responsible for anemia also?
Yes, absolutely. Because iron is a nutrient which our body doesn't have, and we need it from the food. If kids are, or the adolescents, if they are having junk food, fast food, processed food, naturally they will not get iron. And apart from iron, there are certain other vitamins as well, which they will not get from this junk food and fast food, because the food is processed so that the vitamins get destroyed in the cooking or in freezing or in processing. So they will not get essential vitamins which are required for erythropoiesis or for hemoglobin formation, and they will land up into anemia. So they have to be very, very, very careful. Another thing is good amount of vegetables and fruits they should have. So because these fruits and these vegetables, they have certain vitamins and iron, which are responsible for hemoglobin formation.
Right. So, besides dietary habits, deworming is important to treat anemia in this age group.
Oh, yes, very important because sometimes it is missed even in pregnant ladies. So, teenage is all the more important in teenage, that deworming is really important because some of the other time they must be having food outside, and sometimes the food is cooked by maids and all. So, there are more chances that they have a worm infestation, and this worm infestation is the cause of a chronic little bit of blood loss from the body, and in spite of taking good diet, they may not come up with good hemoglobin levels. So deworming is very, very important. Ministry of Family Welfare, Health and Family Welfare has also recommended deworming at least twice a year. It's really important to get rid of worm infestation.
So, what tips will you like to give them about nutrition to overcome this anemia in this age group?
Uh, About nutrition, as I said, avoid junk food, avoid fast food, avoid processed food. One. Another thing is take good amount of fruits and vegetables. Avoid tea and coffee, which is very, very common among the younger population, or maybe among everybody. Avoid tea, coffee, wine, or anything along with your food, because this tea, coffee, and all these things, they contain certain or certain chemicals or maybe tannins which prevents absorption of iron from the body. Suppose kids are taking a good amount of fruits and vegetables along with their meal, but they take a cup of coffee along with it. So it's of no use because it's going to prevent the absorption of iron. So for them, it is important that they should avoid tea, coffee along with food, number one. And number two, they should take citrus fruits, lemon, orange, all these things, or maybe amla or something like that along with meal, which increases iron absorption. And most of Indians are vegetarians, and we all know the vegetarian or the plant-based diet has less amount of iron, or it has a non-heme iron. If they are non-vegetarian, all the more good. The non-vegetarian diet is, the iron from non-vegetarian diet, meat, fish, poultry, etc. Absorption is 2 to 3 folds higher compared to vegetarian diet. And if they are taking non-veg along with the diet which is low in iron content or contains non-heme iron, this non-vegetarian diet will improve iron absorption from these non-heme iron sources also.
Very
So
nice.
they should take iron-rich food and vitamin C rich food or B12 rich food, and avoid cola, avoid tea, coffee, etc.
बहुत अच्छी बात बताई
Anything
आपने.
you want to add, ma'am?
नहीं. I'm just listening and adding to my own knowledge from here. Yes, टैन जो होते हैं इसमें वो बहुत ज्यादा आयन एब्जॉर्प्शन को से वो करते हैं पर आपने बहुत अच्छा बताया. एक रिमाइंडर जाता है सुन के. कुछ चीजों को हम
Right,
टेकन ले लेते हैं.
right.
So, are there any causes which are genetic and can lead to anemia?
Yes, there are a few causes of anemia apart from nutritional anemia. These could be hemoglobinopathies like thalassemia, sickle cell anemia, or other hemoglobinopathies. And when we are talking of iron, and iron-rich food, sometimes the message the mothers carry or the adolescents they carry, that take iron-rich food and she should be all right. It's not that. If a girl is anemic, it is all the more important for her mother or herself to consult her doctor, because there could be some other cause of anemia as well. It could be hemoglobinopathies, it could be infection, it could be cancer, or it could be diabetes. There are so many other causes of anemia. So one has to reach the root cause of anemia and then treat, apart from nutritional anemia.
बहुत अच्छा बताया आपने. थैलेसीमिया तो काफी बड़ा हैजर्ड है और
Yeah.
जिसको किसी को मेजर थैलेसीमिया हो जाए जिस फैमिली में पूरी फैमिली को परेशानी होती
And
है.
you feel so bad that the parents gave birth to a baby who has major thalassemia. Why were they not treated, or they were not informed? It's, sometimes you really feel bad. Rather, in my practice, all girls, even if they're not planning pregnancy or marriage or something, whenever they turn to me, I always ask them to go for hemoglobin electrophoresis, HPLC, so that we know beforehand that she doesn't have thalassemia. At least if she has thalassemia phase, she knows how to tackle anemia.
बिल्कुल, बिल्कुल। थैलेसीमिया ट्रीटमेंट के लिए ने बहुत सारे वो बना रखे हैं, बट आई थिंक थैलेसीमिया स्क्रीनिंग शुड बी वन थिंग वी शुड बी डूइंग।
Should be
जस्ट
there.
I had a lady, she said in my second pregnancy, I found out that thalassemia was positive
Yeah.
major the fifth month, and I suffered so much. Now I have thalassemia
Right.
minor. My daughter has thalassemia minor. इसकी शादी करने के पहले इसके हस्बैंड का जरूर टेस्ट कराऊंगी।
Absolutely. And you feel so good when you diagnose and you are able to counsel them properly. With my practice, there is a couple going on. Their husband wife both have thalassemia minor. So it's
Hmm.
very difficult. They need good counseling before they go ahead with pregnancy. Right.
एक one listener has asked me कि what are the common symptoms you have told them, but I think repeat it for them. What are the common symptoms from which one can know that a particular child is suffering from anemia?
See, if a girl or the child was very active, but the moment she or he enters into adolescent phase, becomes little weak, away from the gatherings, become weak and lethargic or fatigue or complains of breathlessness and has irritable mood and says कि मेरे फेस पे ग्लो नहीं है, या मेरे हेयर फॉल बहुत ज्यादा हो रहा है, या मेरा मन नहीं कर रहा बाहर जाने का, घूमने का, और मे बी द गर्ल वॉज वेरी एक्टिव इन स्कूल इन प्लेइंग एंड ऑल इन स्पोर्ट्स एंड नाउ शी रन्स अवे फ्रॉम स्पोर्ट्स, and then if a girl was very good in studies and now she says, mama, I cannot concentrate, and even if I'm studying I cannot remember anything. So that could be one cause. And sometimes, stunting of growth, maybe they're not growing as well as they should have grown, or the height should be as good as it should have been, and if it was not good. And maybe if a child complains of leg pain or muscle cramps, we should not avoid that also. So that could be one reason. Or maybe oral ulcer, soreness of mouth, or the cracks at the edge of the lips, कि आपका कहते हैं मुंह आ गया है, या मेरे लिप्स कटे हुए हो रहे हैं, बहुत ज्यादा फट रहे हैं लिप्स के साइड से. So that also is important. We should take care of all these symptoms.
So can
Palpitation, घबराहट ज्यादा हो रही है.
so anemia से क्या पीरियड्स भी बंद हो जाते हैं, कम फ्लो हो जाता है?
Yes, I will not say complete amenorrhea. It's a vicious circle. If she bleeds more, she will lose more blood, she will become more anemic. More anemic means more blood loss again. So it's a vicious circle. The more anemia, more bleeding, more anemia. So it goes on. And a time comes when anemia may cause irregularity of the period, or sometimes may cause delay in period. Few studies have come up with amenorrhea in iron deficient girls. We call it iron deficiency amenorrhea. So the logic behind is that your body does not want to lose any more iron because already the body is deficient in iron. And in sickle cell anemia, we have seen that it delays puberty by around 2 years or so when a girl is suffering from sickle cell anemia. So, as such, delayed periods and irregular periods are there with anemia, with initial phase of excessive bleeding during menses.
बहुत अच्छा बताया आपने। तो आयरन को डाइट में कैसे बढ़ा सकते हैं? कुछ टिप्स हमारे सुनने वालों के लिए?
डाइट में हम कैसे बढ़ाएं आयरन को? First of all, start taking diet which is home-made cooked food, which contains lot of green leafy vegetables, and avoid deep frying of vegetables or overcooking of vegetables like spinach and all, which are rich in iron. But if you overcook them, then this will destroy folic acid, B12 from it, and you will not get the desired effect you want. So the diet is home-made food, and take citrus fruits like lemon, orange, amla, anything along with your main meal, and Avoid tea, coffee, cola, etc. during meals. प्रॉपर हैंड हाइजीन, हाथ धोना बहुत जरूरी है। आयरन रिच करने के लिए हमें विटामिन सी लेना जरूरी है, फ्रूट्स लेना बहुत जरूरी है, वेजिटेबल्स एंड सैलेड, cucumber, tomatoes, all these things, the green leaves, all green leafy vegetables are rich in iron. But if you take raw leafy vegetables in the form of salad, that really helps. That increases your iron absorption. And if you are taking non-vegetarian food, then along with non-vegetarian food, if you are taking salad or anything, or maybe some cereals or legumes or something which contains non-heme iron, that also will increase your iron absorption. So we can
बहुत
divide food into, low iron bioavailable and intermediate and high iron bioavailable. When I explain to my patients, I say low iron bioavailable means आपके खाने में iron कम है. कौन सा खाना है वो? Cereals and pulses with very minimal amount of ascorbic acid and non-vegetarian food. तो अगर आप केवल नहीं डाला, हम तो दाल रोटी खाने वाले लोग हैं, नहीं चलेगा दाल रोटी से काम. You have to include vegetables. So that becomes low iron bioavailable diet. And intermediate iron bioavailable diet means you have roots and tubers like potatoes, etc. Roots and tubers. Along with roots and tubers, you have little bit amount of ascorbic acid and, if possible, little amount of non-vegetarian food. So even potato, we cannot deny potato also with skin. If it is taken, it has good amount of iron. Even carrot, etc. Carrot also is good, though it contains non-heme iron, but it is good in iron. So fruits and vegetables are really good. And high iron bioavailable, as I said, red meat, fish, poultry, all these are high iron bioavailable diet because they contain heme iron, which is 2 to 3 fold higher absorption of iron from the body, from the food, and hemoglobin buildup is very, very good with non-vegetarian diet. But don't
बहुत
worry, if we are vegetarian, we can go ahead with germinated food and sprouts, etc., which are rich in vitamins.
बिल्कुल बिल्कुल सही बताया आपने। अब एक कुछ पूछना चाहते हैं ये लोग कि कैन एनीमिया बी कॉज्ड बाय एक्सेसिव ब्लीडिंग ड्यूरिंग मेंसेस एंड कैन एनीमिया द कॉज ऑफ एक्सेसिव ब्लीडिंग ड्यूरिंग मेंसेस, दोनों चीजें।
It's both ways. Both are
या
responsible. Anemia is responsible for heavy bleeding because your uterus, as I said, all the tissues, all the cells in the body need oxygen. And oxygen is carried only through hemoglobin. Hemoglobin is iron. So if you are deficient in iron, you are deficient in hemoglobin and you are deficient in oxygen. If your oxygen carrying capacity is not good, you have uterus which is weak. So uterus will not contract as easily as it should have been. So you will bleed more. If she bleeds more, she will be more anyway. So it's both ways.
विशियस साइकिल।
It's a vicious cycle. Yes.
So, are there any other deficiencies of some vitamins or minerals which can lead to anemia also?
Yeah. Yes, very good. Because when we talk of iron deficiency anemia, or maybe as such anemia, we just discuss iron, 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 which is body's gold. But it is not only iron. जैसे हम अपनी बॉडी को चलाने के लिए हमें सभी कुछ चाहिए ना, बॉडी के सारे पार्ट्स चाहिए, ब्रेन चाहिए काम करने के लिए, ऐसे ही हीमोग्लोबिन बनाने के लिए या एनीमिया को कम्बैट करने के लिए there are so many things which are needed. We call it erythropoiesis. So the factors which are required for erythropoiesis means फॉर्मेशन ऑफ हीमोग्लोबिन, है ना, हमें ब्लड तो बनाना है बॉडी में, तो उसके लिए हमें क्या चाहिए? फॉलिक एसिड, B12 and vitamin C are very, very important, and certain other hormones also are required, and erythropoietin is also required. So the most important is B12 and folic acid, which I will say is required for formation of hemoglobin in the body.
Right. So, what are the foods, which are high, which have high amount of iron? I think you've told us. Another listener has asked, कि does cooking vessels which are made of iron, does that add iron to diet?
Sorry, I didn't get it.
Cooking in vessels,
Cooking. Yeah, iron vessels, of course. They help a little bit. Yeah.
Okay. So, do the anemic children need to avoid some foods?
Yes, they should avoid tea, coffee, cola, wine, etc., which contain tannin, and tannin inhibits absorption of iron, and it binds to the iron and takes out the iron from the body. So does not let it absorb. Number one. Number two, they should avoid, phytates, the diet which contains like high fiber or whole grain diet which contains more of phytates. So there also iron absorption is little bit inhibited. But I don't mean by that that avoid taking wheat or rice or etc. You can go for brown rice or you can go for fruits and vegetables along with diet. And otherwise, phytates, they prevent iron absorption. So they should be avoiding too much of phytate containing diet like whole grain, with, like bran, etc. So they should be avoiding that as well.
Okay. So, there's a common myth, that the foods and vegetables which are red in color will build up the hemoglobin, like beetroot, anar. Is it true?
Yes, you can say it is true. Red color helps the other. That doesn't mean the red color is responsible for iron. It's the iron content of the fruit and other vitamins like vitamin C. When we talk of beetroot, it doesn't contain only iron. It contains vitamin C as well. So which is required for iron absorption, which enhances iron absorption. So if they take beetroot, they will naturally be benefited for iron intake. And same stands true for pomegranate as well because they contain other vitamins as well. They are highly recommended for iron deficiency anemia because pomegranate contain vitamin C. There are other fruits as well like blackcurrant and mulberries, avocados, strawberries, etc. But beetroot, whether taken cooked or maybe raw, is a rich source of iron and vitamin C. It contains other minerals as well like potassium, magnesium, etc. And not only beetroot 100 gram approximate gives approximate 1 milligram of iron. And it's not the beetroot, it's the green leaves of the beetroot that also are rich and they're richer than the iron which is there in the beetroot. It's 3 milligram per 100 gram of leaves. So that also is really good. And
Very
one
good.
should note the bituria also, the red color urine, which some people may get after having beetroot. That may indicate pernicious anemia if you
Oh,
have red color urine after having beetroot. Because
okay.
otherwise the ferric irons, they decolorize the red pigment of the beetroot. But if a lady has or a girl has pernicious anemia, that could be few studies have shown this. So
Okay. That's
beetroot, pomegranate, and other fruits are good.
good. Good. So, in the end, I want a take home message for mothers whose daughters are anemic.
Take home message will be just be careful when you have adolescent girl at home. Just look at her activities, whether she is active, cheerful, and she has glow on her face. She is good in studies, or maybe whatever hobby she has, she does it, from her heart, and she's ready to do it, and she's really happy doing anything. If you feel there are some changes, like you feel your girl is not doing that good, she's not smiling all the way, she's not cheerful, and she's shirking away from her duties, and she's not able to concentrate, she's going down in her academic career, mother should be careful. Number two, just take care of her diet. Keep everything on the table, keep fruits, keep vegetables on the table, keep salad on the table. थोड़ा सा तो खाएगी, आज नहीं तो कल धीरे धीरे उसकी आदत पड़ जाएगी. So keep food ready, fruits and vegetables ready on the table so that she learns having fruits and vegetables like we did in COVID period. There was nothing else to do, so the table was full of food, homemade food. So that is really good. The mother should be careful. And teach her good hand hygiene. Every time wash hands because these are responsible for worm infestation. So good hand hygiene. Everybody in the house should have this habit कि अपने बर्तन पहले wash करने खाना लेने से पहले और अपने hands wash करने. So mothers and all everybody in the house should do this. and take care of her menses. Sometimes girls are a little shy and they don't talk to their mothers, rather they talk to their friends. So be careful, be friendly with them, and if they have any menstrual problem, periods ज़्यादा आ रहे हैं तो भी, periods कम आ रहे हैं तो भी, और नहीं आ रहे हैं तो भी, they should consult their doctor.
Right. So thank you, Dr. Neeru Kiran Banerjee, for joining us today. Could you show us the certificate, please? This is a small
Uh,
token to say thank you
Thank you
to you.
so much. Thank you so much,
Uh,
ma'am.
Not worth your time, but yes, we did enjoy
It
this
is,
talk.
it is. You
Hope
know,
back to us
jo-
sooner.
joining you and talking to you is more important to me. I'm blessed. I'm honored
Thank,
to be with you.
thank you. But it was very nice. आपने बहुत अच्छी अच्छी बात listeners को बताई, and they will be very happy. Thank you. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.